artist. Hello, everybody. Welcome back to Mental Health Today show. I'm your host, Ken Stearns, and this is a final interview from the live session we've been doing today here at the Kabuki Hotel in San Francisco. We're at the Future of Employee Mental Health. It's been an awesome show put on by Grey Green. They're out of the UK and been doing a great program today. We've had really great faculty is what they've called it, the people coming up and sharing either as session speakers or on a panel. And there've been some really interesting panel discussions. Our next guest, Tara Davis. Tara, welcome to the show.
Thank you so much.
Yeah, it's good to have you. And you're an awesome panelist.
Thank you.
And you had a good meaty session as well. They gave you a good piece to talk about.
It was a great piece. I appreciate that because it was last. So.
Yeah, and you got on last as well. So it was really good.
No one fell asleep.
No one fell asleep, and you had the angst. You got the angst all day waiting for your episode.
Yeah, that was wonderful. That was really good for my mental health.
It is really good for your mental health, especially if you have anxiety. Thanks everybody for listening and supporting Mental Health Today. If you're watching this on one of our live shows, that's great. Just make a comment or give us some love. Just find a share button. And then if you are with us on the recorded session somewhere down the line on iTunes or Spotify or whatever platform, give us a little bit of love.
This is live right now?
We're live right now on Facebook, Twitter, LinkedIn, and YouTube. Our beautiful faces. Tara, how did you get into this business?
Well, my job is I'm the Director of Internal Communications and Staff Wellbeing at the American Psychological Association. So I studied psychology in college. And have you ever seen the show Avenue Q? Do you know what I'm talking about? It's a great Broadway show with puppets.
Okay.
And there's a song that's "What Would You Do with a BA in English?" And that's kind of where I was. What do I do with a BA in psychology?
Okay.
Yeah.
Okay.
And I knew I didn't love research. I just didn't know. So I Googled American Psychological Association. Do they have jobs? Is it a place? I only knew about APA Style, which made college.
You just
really
Googled the company. You just Googled the organization.
I Googled it, and I was like, "Oh, they have jobs." So I started there a month after college and moved to DC. My sister lived there, so it made sense. And so APA was a great first job. The job that I was doing at the time, I was remote before remote was cool or acceptable. I was at home 4 days a week. So it was a really great transition to the real world. And I did it for a few years. And I realized, wait, I chose psychology because I wanted to help people. This doesn't really feel like a right fit for me. I want to do more helping. And I had done some things to improve the organization through various groups. But anyway, I decided that I needed to make a change. And so I was thinking about going to grad school. And then I decided to apply for this job that was in a very different office than what exists now, but it was really about employee engagement, which this was a while ago. This was like 15 years ago. So this was before it was cool.
We had this way in front of the curve.
Yeah. And I mean, APA is, I should have said, APA is a large mental health organization. We have the mission of using and advancing psychological science in order to improve people's lives. And so APA is very focused on mental health, both internally and externally. You asked a little bit about what the organization was. We have about 120,000 members, maybe more than that now, but they are psychologists, practitioners, scientists, educators, all, using psychology and advancing it to improve people's lives in whatever their sphere is. So I knew of APA in that way, but I really didn't know of like the impact that it actually has, which is incredible. And so I started this new role, and I wasn't remote every day at the time. So I had to give that up, but it was worth it because I felt like, oh, this is actually going to help improve, do something to help people's lives. So what that looks like now is, We're a very small office, but we are really charged with improving the mental health of the employees in our organization, focusing on their well-being holistically. So, looking at, all the aspects of well-being, financial well-being, occupational well-being, spiritual well-being, connectedness, all of those things, to try and make their work day, their work experience the best that it can be. And so really, I am striving to create an environment where these folks, we have about 550 employees, where they can flourish, where their mental health is prioritized and protected so that they can then do the good work out in the public, right? So like impacting them, hopefully, so that they can then impact others who can then impact others, and on and on.
Yeah. What kind of work do they do? What kind of work are they doing, right? When you go outbound, what does that look like?
Yeah. So,
What's the mission?
So, right. So, APA is about advancing psychology, and that's in a lot of different ways. We have scientists, we have people who are working in advocacy on Capitol Hill, on many different issues, gun violence, on immigration, basically using psychological science in all aspects of the world to inform our decision making, to inform, how things function. And so speaking into like the AI space, speaking into education, there was recently APA issued an advisory around kids and social media.
Yeah, I've just seen this.
Yeah. And so really like taking the research on, what does the research show around kids engaging in social media, and then giving the public and our members tools to actually make behavior changes based on that, or, if their parents, tools on how to help their kids. So I really have the utmost respect for APA. Obviously, I wouldn't still work there if I didn't, but it's really beautiful because, we do have these members that we support and they're doing good work in whatever area. But then we also put out a lot of things for the public. Our website has fact sheets on all sorts of things that you can, say you have a family member who's struggling with anger, or say you don't know how to talk to your kids about war. That's obviously been a very relevant topic lately. And so we have all of this awesome research. So rather than just guessing, you can go to our webpage and you can look at any one of our number of topics pages, and you can get real like data-driven ideas and tips on how to approach these daily subjects that affect all of us. So another reason I really love working for APA is we stand, we really stand for a lot of social justice issues, and really just striving to improve lives. And so my piece of that is improving people's lives at work, but APA as a whole is trying to improve lives and speak into, where we have something to say to improve things. We're obviously going through really hard things as a world right now, but speaking in where we can. So we put out surveys like the Stress in America survey, our Work in America survey, where we find out what is really plaguing people, what is stressing them out. And we take that data and then we give tips on how you can cope and how you can manage those things. And our CEO takes a very like population health approach that it's, we all can benefit from these tools to build our resilience and to be able to learn how to cope with stress, manage stress, cope with things that come up. And, if we have those tools under our belt, then when crises do hit, we're better able to manage them. Agreed. So anyway, that's a lot of answers to that one question.
Yeah, but it was comprehensive.
I don't know. I actually feel like I could have talked for 3 more hours about what APA does, but there you go.
Anything, do you follow the data? I imagine you guys turn out a lot of information.
Yeah.
Anything you've seen in the last few months or the last year that you looked at and went, oh, like that just really surprised you or shocked you or worried you?
Yeah. So, obviously, as I mentioned, we've been focused on mental health. That's what we do. But and I mentioned APA puts out a Stress in America survey, and it was annual up until the pandemic, and then we started doing it more frequently. And so, just watching the levels of stress increase, and the levels of uncertainty and the just stark effect on people's lives. Like one of the things that really struck me was, I think it was, if I get this number wrong.
Yeah, it's okay.
Sorry.
Yeah, that's why I don't want to call it like the numbers are less important, more about the emotion, the reaction that you get. And so people understand, whoa, that's concerning to you.
Yeah. So
we should all be worried.
I think it was a third, but yeah, the point is people were feeling so overwhelmed. This was from last year with the pandemic and this cascade of trauma that they like couldn't even decide what to wear that day, because they were just like the cognitive load of everything, the stress of everything, the trauma. And our CEO, has called it a syndemic. Like it wasn't just a pandemic. It was also, there was racism and political division and violence and now war and all these other things, right? All these other traumas that we're not healed from that are still piling on. And so there were really stark numbers of the behaviors people have engaged in from trying to cope with a pandemic, especially early on. So I think, a lot of our social supports and our ways that we would normally cope with something were taken away. Yes. So people were engaging in a lot more alcoholic beverages, like overeating, undereating, oversleeping, undersleeping, and like the numbers for weight gain, the numbers of alcoholic beverages consumed per week, all of those, you can find them in the reports, were just like really, really shocking. And also just, people, the hopelessness that seemed to come out, just the feeling of so overwhelmed, and feeling like everything was kind of out of your control.
Yeah.
So that was really shocking. Shocking, not surprising, but the data was like, whoa, like the actual number of pounds gained, like the actual number of beverages, it's all in the report.
Yeah, because it's bad.
It's bad.
But when you see that, that's kind of what I was like, when you see that data, what did that feel like versus, because we all know it's going to things have gone bad, but you see the data and it's like, well, that's heavy on your shoulders. You're like, whoa.
Yeah, it is heavy.
And that's real people.
Yeah. And so
trying to survive through this, trying to cope.
Yeah. So that is like the, but then on a more hopeful,
I was going to say, that's a great one. Yeah. Save us. Save us.
In our recent surveys around the workplace, people are reporting that more organizations are focusing on their mental health. So that's a great thing. I think that before, we were doing it because we're a mental health organization, but a lot of employers, organizations didn't see the return on investment, or just felt like, to talk about how people feel, that's this like sunshine and rainbows thing, who cares? But, all along there's been a business case for, investing in your employees and their well-being and their mental health. That leads to greater organizational outcomes and success. So that's been there all along, but this has forced employers to pay attention to it. So more employers are focusing on mental health, and then also employees are demanding it. Employees are saying, if you don't support my mental health in this way, if you don't provide these kind of services, resources, supports, I will leave. And so I think it's really interesting for employees to take a stand in that way, the ones who are able to, and that, we are focusing on this issue more than we have in the past. So there's definitely a movement towards mental health excellence in the workplace. And what does that look like?
Yeah, it was good to see here some big companies. I mean,
Yeah.
I think the Google presentation
Mm-hmm.
blew a lot of people's minds. The
Mm-hmm.
resources Google has
Yes.
are infinite.
Mm-hmm.
And the approach that they shared, that they
Yeah.
have with their mental health approach, powerful
Mm-hmm.
and doing a lot of good work.
Yeah, absolutely. I think that what's really beautiful is that whether you're a small company or a large company, or you're just starting out or you've been doing it for a while, there's always room to grow, and there's always something you can do. And so we take a very science-based empathy approach to all of this. And what that looks like for us is we look at the data and the research to see, okay, what creates an environment where employees flourish and thrive, and where they feel safe, and where they are committed to the organization. Like, what do we do to create that? And like the Surgeon General's framework is an amazing place to start.
Say that again.
So the Surgeon General came out with this framework.
Because I think this is from today as well. The Surgeon General's really does have really good direction.
Oh yes, he actually spoke at our convention last year, and I was just really engaged in how he clearly cares about the topic of mental health. And so his office, and we were able to have some input into it. APA, when I say we, created this model for mental health in the workplace, this framework. And it's really based on needs that we all have. And so it's based on needs, and then those kind of feed into these different components of what it would look like to have a healthy workplace. And it's all based on research. And so it's things like, work-life harmony, not balance, which it never was a balance. So I'm glad we've thrown that out. It's work-life harmony. There's opportunity for growth. There's connection and community. And so all these things are based on needs and based on research. And so like, if you're not doing anything, look up that model. It's a really great place to start. And then you just kind of, so you use that, you use the science, you use this framework, and then you listen to your employees and find out, hey, what do you need? And that changes day to day. It really does. And so you just keep evolving, based on their voices.
I loved the session you finished, right? Maybe you could share just a little bit. We've got a few minutes left. Maybe just share a little bit of what you talked about here today.
Yeah, so I talked about how you can, take data and turn it into action. And so there are a few different ways. Well, there's lots of ways to get data, and that's going to look different at each organization. For some organizations, their data, in terms of what we're talking about here with like mental health services and the well-being of their employees, their data might be usage of the EAP, or it might be, healthcare claims, or something like that, or absenteeism or turnover, or it could be things like an employee experience survey, which is something that we use at least once a year, sometimes multiple times throughout the year, to find out. And so it's not a checklist thing. It's a great, almost like a cheat code into making your organization better for your employees. We say they're the best assets we have, but then we just do things without involving them or finding out if they're working. I mean, sometimes, right? That's what happens. And so you can do things like an employee experience survey, where you ask questions about things that are determinants of, like employee retention. So you can, ask if they feel engaged when they're at work. You can ask if they feel like their work matters. You can ask if they feel safe to take risks. There are a bunch of questions, obviously, you want to ask that are vetted and have benchmarks, but you can ask those things, and it really gives you input into what they care about. And there are a lot of ways. I think a lot of organizations do the one survey, which is awesome. It's better than nothing. But you can also take a more comprehensive approach of like focus groups, or asking employees a totally unrelated question, but it gives you intel into what they care about. So we do a question of the week as a source of connection with our employees. And so it might be, what brought you joy this week? And that's great because, you might say, what brought me joy was this person's puppy because I want to get a puppy.
Oh, yeah.
Sorry to bring that up
I love
again.
it.
Sorry to rub that in. But if you said that, then I might post, oh, here's a picture of my puppy, right? And then all of a sudden we have a shared human element. And then the next time that something comes up at work, I feel fine reaching out to you and we have a better interaction because we've seen each other as humans.
I love this.
So there's that, but then also what do the answers to that question and how do they inform me about what our employees care about? So it's the connection piece, but it's also, hey, most of the employees said what brought them joy was something with their families. Should we have a more flexible workplace so they get more time with their families? Yeah. Should we allow them to bring dogs into the office if they're it's like informs
Fridays or
you.
something,
right?
Yeah.
So asking those kinds of questions and really just allowing your employees to help shape the workplace. We did a huge campaign when we tried to kind of determine what it looked like after we went remote with COVID. Do we go back in? Do we not? Are we hybrid? Are we not? And we just took the research and we took our employee voices and they helped us shape what we now have, which is a remote first workplace. And you can live in 43 different states and your salary doesn't change if you move to a different state. But it's the research shows people care about flexibility in how, when, and where they work. We asked our employees what they specifically were looking for, and then we framed the policy around that, and we evolve it. So some employees said, you know what, I really need to come into the office because I don't like being at home. My kids bug me, or I don't have a door. I have roommates. So
that's a real thing,
it's
right?
a real thing.
I found out that not having the right setup
dedicated workspace
is a really serious situation for work from home.
Yes, exactly. Yeah. So because of that, we still have our office space that you can book a desk and go in and work, kind of like a WeWork type situation. Go in and work for the day. And if you want to get lunch and build community, and so I think that, it's really, there's a lot of different inputs for data, and there are external ones that I think we should pay attention to: the trends, the research, the evidence-based research. And then we, apply that internally. We use a framework or a strategy. You don't just want to throw random things at employees, but then you ask your employees and you listen to their voices and you evolve things as their needs, their desires, the organization's needs, its priorities as those things evolve. And so it makes a lot of sense, but I think we weren't really doing it until the pandemic kind of forced us to, as a society, and so that's a bit about the work that I do, and I love my job, and I'm really thankful that I get to influence the workplace for these employees because that's where they spend a lot of their lives. And so if I can, make that better, if I can help improve their well-being, and that affects their family or their community or whatnot, then, I feel like I've succeeded.
Thanks so much for being a guest.
I'm happy to.
Yeah.
It was very fun.
Yeah. Anything else you want to add, or any other message? Or I would say contact stuff, but you're not really retail. So.
No, you mean how they could reach you?
Yeah.
Yeah, of course. You can connect with me on LinkedIn, Tara Davis. You can also find me on Twitter. I have this, I guess it's not Twitter anymore. I feel so old having said that. Is it X?
Yeah, it's X.
Okay. Well,
I think, yeah. It's still Twitter.
You can find me on the things. I really live out kind of what I do at work is who I am as a person. So I have this harmonious purpose. Yeah. So my handle is Let's Wear Love, because I just kind of feel like that's what we're here to do is improve each other's lives and help each other with their journeys. So you can find me there. Love to connect. And if I can do anything in terms of point you to resources.
Yeah, I think that's great. Right. Yeah.
Go to APA.org. You can find the results from our Work in America survey. You can find the results from the Stress in America survey. You can find great resources on anything from, anger to our podcast, speaking of psychology, to talking to kids about difficult subjects, to how to talk about politics at Thanksgiving without making your family members hate you. There's all sorts.
Some solid. That one right there might be the lifesaver.
Yeah.
How to talk politics at the table on Thanksgiving.
Yeah.
And you can get that at the
APA.org.
APA.org.
Science-based tips for you.
I went out.
Oh. Perfect.
Yeah. I'm going to and we're lost to the last bit of microphone. So I'm going to steal Tara's microphone to close it out. This is a perfect way to go. Thanks everybody for listening and supporting Mental Health Today. You know what to do with the social medias and all that good stuff. Big shout out to Gray Green for putting this on and inviting the Mental Health Today podcast to come and be a part of the show. Thanks everybody. And Tara, thanks again so much.
Thank you.